Hello friends, today we are discussing, do you know how to manage PCOS, polycystic ovarian syndrome? There is a quote, sleep disturbances are 2 times more common in women with PCOS. I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM. What is PCOD or PCOS? PCOD is a condition that affects women's ovaries, the reproductive organ that produce progesterone and estrogen hormones that help in regulating the menstrual cycle and also produce small amounts of hormones inhibiting, relaxin, and male hormones called androgens. Almost 10% of women in the world is suffering from PCOD, that is polycystic ovarian disease. In compared to PCOD, women with PCOS, polycystic ovarian syndrome, produce higher than normal amounts of male hormones, that is testosterone. This hormone imbalance causes them to skip menstrual periods and make it harder for them to get pregnant. This is the diagram, picture of ovaries. Here 2 ovaries are there. These are fallopian tubes. These are fimbrias. And this is uterus. This is vagina. This is a normal ovary. Size is small. And there are eggs scattered here. And this is a polycystic ovary in which there are so many cystic eggs. These are the linings of eggs around the periphery. What is PCOD problem? PCOD, polycystic ovarian disease, is a medical condition in which the woman ovaries produce immature or partially mature eggs in large numbers, and over the time, these become cysts in ovary. Due to this, ovaries become large and secrete large amount of male hormones, androgens or testosterone, causing infertility, irregular menstrual cycles, hair loss, and abnormal weight gain. PCOD can be controlled by diet and lifestyle modifications. And what is PCOS? Polycystic ovary syndrome is a metabolic disorder in which the women affected by hormonal imbalance in their reproductive years between the ages of 12 and 51. Due to increased level of male hormones, females might skip menstrual periods, have irregular ovulation, making it hard to get pregnant, get abnormal hair growth on the body and face simultaneously. It can lead to heart disease and diabetes in long term due to these metabolic disorders. PCOS is a serious medical condition and it requires proper medical attention or surgical treatment. Causes of PCOS. Excess insulin production. Excess insulin levels in body might increase androgen production, leading to difficulty with ovulation. Excess androgen production, the ovaries produce abnormally excess androgen hormones, leading to acne and hirsutism in females. Low-grade inflammation. Females with PCOS are having low-grade inflammation that causes increased level of androgen production and leading to blood vessel or heart problems. Heredity. Women with PCOS show certain genetics correlation. Common signs and symptoms. Irregular menstruation, we call it oligomenorrhea. Skipped or absence of menstruation, we call it amenorrhea. Heavy menstrual bleeding, that is menorrhagia. Excessive hair growth on the face, body, including on back, belly, and chest. Acne on the face, on the chest, and upper back. Weight gain, hair loss, hair on the scalp gets thinner and fall out. Skin darkening, neck in the groin and under the breasts. That is called complications of PCOS, PCOD problems. Abnormal uterine bleeding may occur. Infertility or hypertension, infertility, type 2 diabetes, preterm labor and premature birth, metabolic syndrome, that is risk for high blood sugar, high blood pressure, heart disease, diabetes, and stroke. NASH, non-alcoholic steatohepatitis. Depression. Many women end up experiencing depression and anxiety due to unwanted hair growth and other symptoms. Sleep apnea, more common in women who are overweight, causes repeated pauses in breathing during the night, which interrupt sleep. Endometrial cancer due to thickened uterine lining. Miscarriage, spontaneous loss of a pregnancy. Differences between PCOD and PCOS. Some females might be confused whether PCOD and PCOS are the same or different from each other. Both the medical conditions are associated with ovaries and hormonal imbalance in women during their reproductive age between 12 and 51 years and depicts the same symptoms. Here are differences between PCOD and PCOS every female should know. What are the differences? PCOD is common disorder and 10% of the world populations are affected with it, whereas PCOS is serious medical condition. 0.2 to 2.5% women are affected by PCOS. Ovaries produce many immature or partially mature eggs in PCOD, whereas PCOS is a metabolic disorder and more severe, in which that lead to anovulation or no ovulation. PCOD doesn't affect infertility, still become pregnant with medications in PCOD. Whereas in PCOS, seriously affect fertility, hard to get pregnant. If get pregnant, risk of miscarriage, premature birth, and complications of pregnancies are more. PCOD doesn't have serious complications, whereas PCOS have serious complications, type 2 diabetes, heart disease, hypertension, and endometrial cancer. All these are due to hormonal imbalances. Lifestyle modifications and home remedies. Maintaining healthy body weight is very essential in managing this disease. Limiting carbohydrates consumption is also very, very important. Regular exercise, and one should remain very active. That these are the other factors which are helpful in these conditions. Doctor may ask you this when you visit a doctor. What are your signs and symptoms? How often are you having the symptoms? How severe are your symptoms? From when have you started noticing symptoms? Since how long you are having symptoms? When was your last date of menstrual cycle? Have you gained weight since you first started having periods? Did you gain weight? Are you planning for pregnancy? Has your sister or mother ever been diagnosed with PCOS? All these questions a doctor may ask you. Can you have regular periods with PCOS? Some women with PCOS may have a regular monthly cycle each month. Yes, you can have PCOS and have regular periods. Sometimes periods can occur too frequently, several times a month or lasting for weeks at a time. Heavy bleeding can cause women to become anemic or have low iron levels. Does PCOS delay menstruation? When your body has too much androgen, it can affect your regular monthly cycle. This hormonal imbalance prevents the egg from developing or releasing properly. As a result, women with PCOS often miss their periods or have delayed or irregular periods. This is the diet you can have, exercise you can have, and you can measure your waist circumference. Natural treatments, diet changes, balance your carbohydrates and proteins, aim for anti-inflammatory diet. You can use iron, magnesium, and fiber. You can cut your coffee. You can have soy, omega-3 fatty acids, and aloe vera. All these diet changes can help in your treatment or managing your disease. Supplements you can use like inositol, chromium, cinnamon, turmeric, zinc, evening primrose, calcium and vitamin D, and berberine. You can use adaptogenic herbs, maca root, ashwagandha, holy basil, licorice root, nirgundi or chasteberry. You can use probiotics. You keep your weight healthy. Regular exercise is very, very important. Sleep hygiene should be adopted, and there should be stress management in you. Limit or avoid endocrine disruptors as well, dioxins, phthalates, BPA, pesticides, glycol ethers. All these should be avoided. Consider acupuncture, avoiding junk and oily fatty food, or you can use CBD or cannabidiol oil, which can have beneficial effects. Thank you very much.